Have you ever stopped to think about the incredible journey happening inside your body right now? Millions of tiny, round red blood cells are flowing through you, carrying the very oxygen that gives you life. They are soft and flexible, able to squeeze through the smallest of pathways to reach every part of you. But for millions of people around the world, this process is disrupted by sickle cell disease. This blood disorder changes the very shape of life-giving cells. Instead of being smooth and round like a donut, some red blood cells become hard and sticky. They form a C shape, like a crescent moon, or like a farmer's sickle. It is a small change with enormous consequences. These sickle-shaped cells are not the graceful travelers healthy cells are. Their rigid shape makes them get stuck in small blood vessels, creating traffic jams that block blood flow. When blood flow is blocked in the body, it can cause excruciating pain. This isn't just a physical condition. It is a daily reality that shapes every aspect of a person's life, from their childhood dreams to their adult responsibilities. It is a story that needs to be told with compassion and clarity. Understanding sickle cell begins with its global impact. Every year, more than 300,000 babies are born with this condition. That's like a new baby entering this struggle every 2 minutes. While it can affect people of any ethnicity, it's most common among those with ancestry from Africa, the Mediterranean, the Middle East, and India. In the United States, about 100,000 people live with sickle cell disease. These are not just statistics. They are individuals, families, communities whose stories call for greater awareness, better care, and a brighter future. The story of sickle cell disease is not one of contagion or lifestyle. It is a story written in our genes, passed down through generations. It is an inherited condition. You are born with it. To understand how, we look to our DNA, the blueprint of our bodies. We inherit genes from our parents, which determine things from eye color to blood type. Sickle cell disease is caused by a mutation in the gene that instructs the body to make hemoglobin. Hemoglobin carries oxygen from our lungs to the rest of the body. To have the disease, a person must inherit 2 sickle genes, one from each parent. When both parents are carriers, 25% chance disease, 50% trait, 25% unaffected. Parents may not have the disease. They can carry the sickle cell trait, 1 sickle gene, 1 normal. Most with the trait have no symptoms and live full, healthy lives, which is why genetic counseling and testing are so important. Sickle cell disease touches lives worldwide, but its presence is most profound in certain regions. Its map is tied to human migration and adaptation. The sickle gene is common where malaria is or was widespread. Sub-Saharan Africa, parts of the Mediterranean, the Middle East, and India. Carrying 1 sickle gene can protect against malaria, helping the gene persist. Most people with sickle cell live in Africa. Over 75% of affected newborns are in sub-Saharan Africa. In countries like Nigeria, Ghana, and the DRC, it is a major public health challenge. Limited access to screening and care means many children do not survive to age 5. In the US, it affects about 100,000 Americans, most prevalent among African Americans. Understanding distribution directs resources and highlights a human rights imperative. Life can be punctuated by unpredictable episodes of intense pain. These pain or vaso-occlusive crises are the hallmark of the disease. They occur when sickled cells block blood vessels. The pain can be sharp, throbbing, and deep. In the chest, arms, legs, back, or abdomen. A crisis can last hours or days, sometimes requiring hospitalization. Chronic anemia is common, as sickled cells break down faster than healthy ones. Fatigue, breathlessness, dizziness, and paleness can follow. In children, delayed growth and puberty can occur. Acute chest syndrome causes chest pain, cough, fever, and difficulty breathing. A medical emergency. Stroke can occur, even in young children, causing lasting challenges. Frequent hospitalizations disrupt school, work, and social life. Holistic care must address physical pain as well as psychological and social needs. While we search for a universal cure, we have effective ways to manage sickle cell and improve life. Treatment pillars prevent complications, relieve symptoms, and extend healthy life. First, pain management. Crises require prompt, effective relief, sometimes with opioids in hospital. Mild pain may respond to over-the-counter medicines and hydration to improve blood flow. Second, preventing infections, especially in young children. The spleen is often damaged early, raising infection risk. Daily penicillin from infancy to at least age 5 saves lives. timely vaccinations are critical. Third, hydroxyurea, a daily pill that boosts fetal hemoglobin and reduces sickling. It lowers pain crises, acute chest risk, and transfusion needs. Fourth, transfusions provide healthy red cells for severe complications and stroke prevention. Regular transfusions require monitoring for iron overload and chelation therapy when needed. Together, these pillars form a comprehensive plan that truly makes a difference. For decades, there was no way out. Today, cures are becoming reality for some. A bone marrow or stem cell transplant is the established cure. It replaces the body's blood cell factory with healthy donor marrow. Matched sibling donors, often a brother or sister, offer the best outcomes, over 90% in children. But fewer than 1 in 5 have a matched sibling. Unrelated or partial matches are possible but riskier, including graft versus host disease. High-dose chemotherapy is required, so not everyone is a candidate. Gene therapy uses a patient's own stem cells, collected, edited, and returned. Some add a corrected gene, others use CRISPR to fix the mutation. Trials show remarkable results. Healthy red cells, crises stop, transfusions end for several patients. It's still early, complex, and very expensive, available to few in trials. The road ahead: make cures safer, accessible, and affordable. A tale of two realities: what is possible versus what is accessible. In high-income countries, a child with sickle cell can live a long, productive life. Universal newborn screening enables immediate intervention. Preventative penicillin, timely vaccines, and parent education. Access to hematology, hydroxyurea, and safe transfusions. Over 95% survive into adulthood. In many low-income regions, newborn screening is rare and diagnosis comes late. Penicillin, vaccines, and hydroxyurea are often unavailable. There are too few trained clinicians and blood supplies are unreliable. In parts of Africa, 50% to 90% of children may not reach age 5. Closing this gap is a moral imperative. Strengthen systems and ensure affordable medicines. Every child deserves the chance to survive and thrive. A diagnosis can feel overwhelming. Knowledge is power. There are concrete steps to take control of your health. First, learn your status. A blood test shows if you carry the trait. This informs risk and reproductive choices. Expecting? Prepare for early testing and newborn care. Second, insist on newborn screening and confirm results. Third, connect with a sickle cell care team led by a hematologist. Plan vaccines, penicillin for young children, and discuss hydroxyurea when appropriate. Regular checkups are your lifeline. Fourth, create a clear, written pain plan with meds, doses, and ER triggers. Keep it accessible and share with school, caregivers, and family. Finally, find community through advocacy groups and local support. They offer emotional support, practical advice, and resources. We must move from statistics to solutions. Support universal newborn screening and access to penicillin and hydroxyurea everywhere. Train healthcare workers and invest in safe blood supplies. Fuel research in transplants and gene therapy so cures become safer and affordable. A cure must be for everyone, not just a privileged few. Together with compassion and action, we can build a future free from sickle cell.